Hi everyone, I'm Dr. Amanda Zariello from Restore Physical Therapy in Cranston, and today I'm going to talk to you about movement patterns and why you might be still suffering from the same injury years and years later. So what happens when we hurt ourselves? Let's just take the ankle sprain for example. Say 10 years ago you rolled your ankle and you think you healed from it, your pain's gone, you're walking fine, you're getting back to all your regular activities, but you still haven't quite changed the way you are moving. And it can be very subtle, but a lot of times when you have an injury, your brain, the role is to protect your body. Your brain will want to keep your body and your joints safe, so it will create a pattern to prevent you from causing more stress to that ankle. So you find a new way to walk because it's less painful, which makes sense. The problem is 10 years down the road, if you never fix the way you were supposed to walk because of that ankle injury, you're going to come in later with a knee or a hip or a back issue because the way our body is designed, it's designed a specific way to absorb force when we walk. And when we avoid those range of motion and those, when we don't shift our weight the way we should, something else is gonna react and get overworked or stressed at some point. So when you're rehabbing any injury, it's really important to make sure that you don't only just strengthen and stretch and get range of motion back in that joint, but you change the way you move so you're going back to loading that ankle the way you used to in the past. Full rehab should change the way you move, not just strengthen, not just stretch, not just ice, not just recover. It's really changing your mechanics and making sure your brain knows how to control your movement patterns.